Good morning, everyone. I call the Saline County Commission Public Forum and Meeting of June 23rd, 2015 to order. Would you all please stand and recite the Pledge of Allegiance in a moment of silence?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Will the clerk call the roll?
Commissioner Shadwick.
Here.
Commissioner Guile.
Here.
Commissioner Price.
Here.
Commissioner Larson.
Here.
And Commissioner Smith.
Here.
Thank you.
I now open up the public forum, and it's a time for any citizen to come forward to talk about something that's not on the agenda today, and time is normally limited to 3 minutes. Is there anyone that would like to come forward at this time? Thank you.
Hi, my name is Casey Ziegler. I feel like I've been up here a few times now, but it had come to our attention from a, can you not hear?
Yeah, get a little closer to the speaker, can't hardly.
Okay. It came to our attention from a community member that there might have been some more questions regarding the Heartland programs. And so I provided a couple of handouts. It sounds like one of the questions was regarding to the enrollment signs that are around town and why we're enrolling when I'd said we're full. Well, as you can see from this diagram, we have many programs, and those signs that are being that are up right now are specifically for our Head Start program and for our state at pre-K program. So that's what those are for. However, we are constantly recruiting children for all of our programs. If you look at this document, in the far right column, we are required to have a wait list. If we have a child leave, we have to fill that vacancy within 30 days. And of course, with any government program, getting somebody all their paperwork completed, making sure they're eligible, that takes time. So we are constantly recruiting children, but we are full in the home-based program. The program that the two health department staff help us with specifically are on this document again, the top line for those 83 children. And if you look at this one with the circles, the green circle that's the tallest, that would be the program out of all of these that those staff are working with. So I guess I just kind of want to ask you if you have any questions. Another thing that was brought up is statistics. I know John wanted statistics. Jason Tiller and I we got together right away. He has a report of a lot of statistics. It is something that will be coming quarterly, and I also included a success story, and I'll continue to do that. I think Jason will be presenting it to you with all of the programs, and that's probably why you haven't seen that yet. But I'll be doing that quarterly, and so in July, I'll be creating a new quarterly report for you.
Very good.
And I think, if you remember, it was a 5-0 vote that we support this. So don't feel that
Okay.
we're not
Yeah.
thinking of anything else.
Okay.
And I mean, everybody seems to worry about things, and yet we support things. We support home health. We support all these things, but people seem to be, employees seem to be worrying about it.
I thought we were all on the same
We are on
page, and
that,
I'm
yeah.
glad to hear
Yeah.
that.
And I
there
think
is somebody
statistics would be nice. We should see statistics.
Yeah. We
And
just
it's
have a
just
concerned citizen who's made it very clear
Well-
they didn't think you were informed, so
Well,
I wanted to make
that's,
sure.
I can imagine where that came from.
Well, that
you know.
could be.
Well, this is helpful information, and we
Yeah.
appreciate you coming by
Okay,
today.
and I gave you my card. If you do
Yep.
ever have any questions, don't hesitate to call.
Very good. Thank
All
you
right,
for
thank
coming
you.
by. Appreciate your time.
Thank you.
Anybody else like to come forward at this time?
Hello, my name's Suzanne Myers. I live at 747 South Ohio. Commissioners, I've been employed by Saline County for the last 18 years, and I started as a receptionist. And I've worked my way up to the position, through all of the positions in our office, to the position which I hold today, which is commercial appraiser. During that time, I've had a bumper sticker displayed in my office, and it reads, "Quality government doesn't just happen. It depends on quality public employees." And I'm here today on behalf of the quality public employees of Saline County. These employees are not the newly hired employees, but they're the ones who those newly hires go to for advice or if they have a particular question. They're the ones who spend 20 minutes on the phone with an irate taxpayer who's frustrated because they don't understand a new filing law for mobile homes or boats. They're the ones that take the extra time to explain how the Kansas real estate tax system works to new citizens that come here from another state. They're the ones with the knowledge to explain what happens to railroad land when the railroad's done utilizing it. These employees have dedicated their lives to a career with Saline County, and they're not bailing out at 3, 5, 7 years to find work in the private sector because the skills that they've learned here at Saline County have made them more valuable. These are the public employees that stay here. They utilize the skills to benefit the office they work in and the people that they serve. These are the law enforcement officers who have worked to build relationship with the people they serve. These are the employees who see a problem and work to find a solution. Quality public employees stay here to serve. They take a second job if ends don't meet rather than walking away and taking their experience and training off to the outside. They stay because they believe that all other public employees, including the commissioners, have the same goal, which is to provide the citizens of Saline County a government entity that stands above the others as honest, trustworthy, dependable, and fair. My name is Suzanne Myers, and I am proud to be a quality public employee, and I'm asking you to reconsider the salary offer on the table to something more equitable to those quality public employees that make Saline County proud.
Thank you. Anyone else that would like to come forward at this time?
Ray Ruska, 235 North Santa Fe. I have kind of a minor issue here that maybe the commissioners could handle readily. Yesterday I went down to planning and zoning before I get to that, I went on the website to look for planning and zoning bylaws. They were not on the website. And I was kind of taken back that they weren't on the website since other departments provide bylaws on the website. And what I would like to request is that planning and zoning place these bylaws on the website, because consistency between departments I believe is necessary. And we've been working on this to make it more transparent for the public. I think this would be a good way to show, that the commissioners are proactive in providing the information to the public.
I don't think the commissioners would have a problem with that,
Yep.
do you?
I'll look into that. Thank you. Appreciate it.
Hmm?
Anyone else would like to come forward at this time?
Hi, I'm Jessica Hall, and I'm from the Sheriff's Office. I've been with the Sheriff's Office for 20 years, and I'd like to just state that I was at the meeting last night and agree with Suzanne and encourage you guys to consider a fair percentage in the increase. And we understand that the DMG salary study, is a possibility next year, but feel like a flat rate does not justify to the employees that have been there longer, and that not all of them are, sheriffs and captains. That I have employees who work for me who've been there, 10 to 15 years, and they are one of the lower paid employees at a grade 7, and deserve to have some increase that is beyond a flat rate. So,
All right. Thank you very much.
thank you. Thanks, Jessica.
Okay, seeing nobody else, we will move on to item number 1, regular business.
That's a request for action 160-15. It's Emergency Management Performance Grant. Have a staff report by Hannah Stambaugh, Emergency Management Director.
Good morning,
Welcome.
Commissioners.
Morning.
This is a request for action for our Emergency Management Performance Grant for fiscal year 15. This is a request to apply for, and if awarded, to go ahead and accept those grant dollars. This is a grant that is used to enhance or sustain, or enhance and sustain our emergency management program here in Saline County. This is a 50-50 grant, which we utilize for salaries. And how that works is usually we utilize the grant dollars to pay for the deputy director position that is underneath me, and then use my salary dollars as the match, which covers that 50-50 requirement. Their alternatives are to approve it or disapprove it. Of course, if we disapprove it, then we will lose out on probably on average is about $30,000 a year. Is what we obtain for that. In our study session, I kind of explained kind of the history of this grant. We've received this grant every year since 1998. So this is a pretty long time that we've received this. The requirements for it are, very easily obtainable if you have a viable and robust emergency management program, which we do here in Saline County. We're very proud of that. So we would like to suggest that you approve this, and we will go ahead and get everything sent in for it. The deadline for action on this is the 30th of this month.
All right, very good. Questions of staff? Public comment? Bring it back to the commission for action.
Mr. Chairman, I move we approve the request, accept the EMP grant as recommended by staff.
I'll second that.
All those in favor say aye.
Aye.
Passes 5-0. Item number 2.
Request for action 162-15 at MCH Healthy Start Home Visitor part-time position, and also to accept grant funds. Have looks like we have staff report for that by whoever's coming to the podium. Sherry LaFollette, I believe, will give you a report. Also have Laura Lee Tibbetts here and Jason Tiller from the Health Department.
Good morning. You want to get the microphone a little closer to you for the TV audience? That's all right.
The Saline County Health Department Maternal and Child Health Program is requesting approval to hire a part-time 26.4-hour-a-week lay staff person for the position of a Healthy Start home visitor. Mandates of the MCH program are requiring more extensive case management services to be provided to our high-risk pregnant population in our community in efforts to reduce the financial burden and health impact of poor birth outcomes. By hiring a part-time position or a Healthy Start home visitor, we're able to transition some of the duties that are being performed by my professional staff. And again, we would like to fund this with the additional dollars that we received through the grant, through KDHE. There would be no additional costs to the county, and this would provide more billable services to Medicaid. I do understand when you think of additional billable services to Medicaid, you immediately reflect upon the fact of utilizing tax dollars for those who are Medicaid recipients. Give MCH the opportunity to provide another avenue to bring those tax dollars back into the county and back into the community. These funds are not new state or federal dollars or additional funds out of taxpayers' pockets. This additional amount was awarded to our MCH program due to a new state funding formula, our county percentage of pregnant women and children at risk populations, along with the scoring of our grant application. In a nutshell, KDHE is recognizing agencies that are doing their jobs and doing them well. With this recognition, they are placing these funds in counties where the programs are going above and beyond and working extremely hard to meet their growing mandates. The focus of this request needs to be on the identified women and children that we serve that are high risk. They need ongoing, regular case management, and currently we do not have the staff capacity to provide that. Early intervention, prevention, and extensive case management follow-up is the key to impact our risk populations and family units as a whole. We have been given this unexpected opportunity with these additional funds, and honestly, if we don't take it and utilize it, I'm sure another county will. Thank you.
Questions?
Sherry, just remind us, or remind me, exactly what the job description will be of this part-time person. What is she actually, when she does the home visits, what is she doing?
She will be providing our hospital, Healthy Start hospital visits, also our lower risk home visits, both prenatal and postnatal, and then as time allows, clerical duties.
And how do you get a list of these homes that she will be visiting?
We get those through our Becoming a Mother program, also through WIC and through Clinic. And then we have collaborative partners with Saline Family Health Cares, Maori Clinic, Dr. Beauchamp, and such. So we have all of our providing clinics that are referring those high risk to our programs.
Okay, okay.
Yes.
And right now, we don't have, she isn't an additional visitor, a Home Start visitor. She will be the only one in that?
We have our nurse, our IN, we have her 1 day a week. She's actually a clinic nurse, and she's with us on Tuesdays, and she has home visits from morning till her end of her day. And then we also have the Healthy Start visitor. Our social worker goes out on very, very minimal, just due to her other additional duties that she's been taking care of. So, yes, this would be.
There is no one else in in that department that does that. This is what this part-time person will do.
Correct.
Okay.
And this grant is a one-year grant?
This is a 1 year grant, and this position would be continuant upon the continuation of this grant.
Right. And that, because I think that that's always people's concerns is, you know, a 1 year grant and then.
Right, obviously.
You know, then
and
you have to-
that was something that, you know, any candidate that would apply for this position, that would be very well known to them.
Because when, let's say the grant goes away and we take away the service, I mean, that creates quite the uproar sometimes in
Right.
the community. You're cutting our services.
From what I
and-
understand, these grant dollars have always been here, and KDHE, in a sense, is rewarding, again, those agencies that are doing their job and doing it well. And by doing that, they are taking from the agencies that have not been able to keep up with their mandates.
Thank you. Okay, thank you.
I think I expressed my concern last week that we were $440 million in debt last year. We upped our sales tax 0.035 to come up with 300 and some million, and then 50-cent cigarette tax. We're still short. They're going to have to cut, what, 800,000 yet, the state. And yes, my concern is if the state has no money, where are they coming up with all this money all the time? And I know if we don't accept it, another county might accept it, but a county that has 12 employees that's larger than us, that we have, say, 35 or 40 employees, maybe they need it more than us. And we had talked about not growing, and I'm still kind of, I don't think we have to have the largest health department in the state. And I think we need to start, we came today, we're having a grant next week about Ebola. And that was a problem. We didn't even have a thermometer in our health department. So there's areas we need to take money and grow. There's times when I think it's going to be time to start saying no. And I think this is a time for me to say no.
If you don't hire this part-time person, what happens to this program, and who's going to do this? Who's going to fulfill this niche?
And it will be shifted to the duties, additional duties will be shifted to who we have now, our employees we have now. So, and we are currently working with 2 volunteers and still
Oh, so we have
struggle.
volunteers that are doing some of this work.
We have 2 volunteers. One is from the SCR program, and then, I'm not sure what the other, again, this was just told to me. The 2 volunteers are elderly from different programs. They are not able to go out and do these visits or any of these duties.
Okay. And then the only other question I had is, the other funds that are listed on this sheet, Laura Lee, what does that mean on the bottom where you have the outreach?
Number.
This is the max amount we can draw down for Heartland. What does that mean?
Correct. The Outreach Heartland program, that is the maximum amount we could draw down. We do not anticipate drawing down that much money. We anticipate drawing down about $71,000, which is the salary component of it. So our expenses total would be, you know, 14.2, and that would mean the 71,000 would be what we would draw down.
Okay, so that's the max, and you don't anticipate.
No, we don't. It just is stating that that is what we could draw down if we would need to draw it down, but we don't have any positions in place in excess of what we would need to draw down at the 71,000.
Okay.
But we've already approved all those grants.
No, right, I just
I mean,
wanted
that's-
a
this is the new-
clarification
This is
on
the
that.
new grant that we're
I
talking about.
understand,
Maybe,
I
you know,
understand.
but it does kind of look like, the way it's listed there, are we approving all these today? Well, no, we're
Oh,
not.
yeah,
We
no,
did
no,
those.
I understood that
I
those are
think
the.
it's really a combined thing. You approved them to go out for the application, and now they received the same, this is the same that they received last year with the exception of this one, so they're kind of,
Yeah, they're adding
You-
one to it.
If
But
you,
Right,
we've
right.
already
The state-
approved the grant on the other ones.
right,
Yeah.
the.
Yeah, the state's added this to it.
right.
Yeah.
The other grants are status quo. Nothing is different. You had approved for us to apply
Right,
for
we've
them.
already
We've,
approved it, right.
we've gotten the totals that we have, and we're basically requesting with regard to outside of MCH, having you allow us to accept them, because we have to do that again by June 30th, just as Hannah
you-
stated on hers.
So your other grants, you can't apply for them yet? We didn't approve all those, we've approved that, we approved that one about the Heartland programs. We've approved those other ones.
You
haven't we?
approved them to go out for the grant. Now
Okay.
the grant's here, and you just need to accept it.
Okay, so if we didn't approve this new grant, we'd have to just have that as an exception to that grant.
Okay.
Further questions or comments? The public comment?
Ray Ruska, 235 North Santa Fe. I recently heard a comment made in a meeting about a hiring freeze. Has everybody kind of forgot that?
That's what I was
little-
talking about earlier. That's what I said.
I know.
We decided not to hire anymore. We've got a large number. That's exactly what I said.
Well, I just wanted to emphasize that, just remain consistent with what you're telling the public in open meetings. Thank you.
Thank you.
Karen Shade, 111 Wisconsin. I would ask that you support the hiring of the lay position, kind of buried in the RFA on sentence 5, if I'm counting correctly, is that this is to provide high-risk pregnant women population in our community services in an effort to reduce the financial burden and health impact of poor birth outcomes among the population. Now, this wasn't brought out in the RFA, but we're talking about babies born under 2 weeks or born under 2 pounds who might rack up millions of dollars in neonatal health care just to keep them alive. We're talking about babies born to mothers with disease states, perhaps diabetes, perhaps high blood pressure, where those medical conditions also impact the child, and that has significant costs for the community. And unfortunately, we're talking about babies born to mothers who might have active addictions, and those children may need lifelong or assistance from welfare systems and in the educational system. So this is where a few dollars spent upfront early on make a huge difference in outcomes that ultimately save taxpayer dollars. I also want to address the benefits of having a social workers do the emotional, behavioral, and developmental screening. I can speak from personal experience where as a teenager, it was very important to my father that I learned to shoot a gun accurately and with consistency. And after hours and hours, hundreds of hours of practice, that wasn't coming about, so we went to a class. And the instructor did some simple screening tests, and it turns out I'm left eye dominant but right-handed. Translation, that means I'm clumsy. But I was probably a natural-born lefty, and my mother corrected it. And so, although I've always had issues with hand-eye coordination, by learning to do something left-handed, I picked up, I can be good at some of those things. And it sure would have been nice if I had been screened at age 5 and you know, if someone might have suggested to my mother, let her be a lefty. Or if I had learned much earlier on that maybe I should do some sports left-handed, maybe I wouldn't get hit in the face with a baseball or be a target for tennis balls and things like that, because I just don't see that and process that information in quite the right way. I was a little bit hesitant to talk about the shooting piece given what happened in South Carolina with the Mother Emanuel Church. But speaking to another need for emotional screenings, I happened to be a 5-year-old kid who lived where we had a neighbor whose father had, they had moved into the community, a mother, a grandmother, and 2 children, where the father had killed 2 other siblings and killed himself. He was 1 child short of being a family annihilator. And I grew up knowing my father, because he had an arsenal of guns and a hair trigger, that if her father could kill siblings, so could my father. And her mother happened to die in a car accident shortly thereafter. And so as a young child, I was highly motivated to do well in school because I didn't think I could rely on either of my parents. I was terrified by the tornado drills and emergency fire drills and all of that kind of thing. And, you know, it shaped my personality. So, you know, there is a huge need to do these screenings with very young kids, and it makes a huge difference on outcomes. Speaking for my biological nephew, at age 7, he was suicidal. And it goes back to some strange observations where if someone might have screened it, caught it sooner, you know, fortunately, there was the ability for interventions from the school for him. He was bullied at school. So these things are really important, and it is a suitable way to spend limited tax dollars. And I trust that the state will monitor and make sure this grant is effective. If it's not effective, it will not be funded. But for the time it is here, for the time we can help Saline County children, I say I would urge you to do this.
Okay.
Thank you.
Thank you, Karen.
I'm going to make a comment. Could it be that, backing up to Heartland programs, could it be that if a mother has 4 children, maybe 3 children and 1 on the way, and none of them are in school yet, I mean, had a baby, 4 months later they're pregnant again, is there an advantage to those people that have babies with our system?
I can't speak to that. I don't know.
I can. I've seen it, and I can look at 2 right now that are in that situation. They take advantage of the system. So I think it also, you can look at it the other way. Maybe you're encouraging people not to do that, but on the other hand, people are taking advantage of it and using the system. It's a great system for them. They got a free babysitter. When they're home on the weekends, the parents have the kids anyway. It's just I see it, and it's out there, and I think everybody knows that. It's out there. I can show it to you.
Commissioner
you know,
Price, the same issue comes up with school lunch.
Though.
And my response is, you know, who wants to be the child born to the parent who wants cigarette money or alcohol money ahead of taking care of them? And yes, it happens, and some of us make peace with providing services that the parents aren't able to provide.
I feel sorry for these children because of what the system's doing to them.
I
really
have
feel
great
sorry
concern
for
for them too.
Yeah. Okay, Karen, I appreciate your comments. Thank you. Further public comments? Bring it back to the commission.
I just wanted to clarify something. The way I understand it, Commissioner Price, or no, excuse me, Mr. Ruska, the way I understand it is when we mentioned that we wanted to do a hiring freeze, I understood it that we don't want to hire unnecessarily when the company is having to fund that in their budget. So anytime we are brought hiring suggestions with funded mechanisms, I'm not opposed to that. So I understand that this is going to be funded by this grant, and it will not affect the county's budget.
Well, the
as far
state's
as
going to charge a third of a
salaries.
cent more, so it is affecting every taxpayer, or a third of a cent more.
I'm sorry?
Sales tax is going to go up
Correct.
3.035. So it is going to affect every taxpayer. Even the very poorest people have to pay sales tax.
Correct.
So it does affect taxpayers.
Thank you for your comment, Lucy. But my point is that grants is your money
I know.
and my money,
It comes out of the same pool.
everyone's money. And whether or not it's connected to costing the county money is irrelevant. Thank you.
Okay.
Thank you. Bring it back to the commission for comments or action.
Mr. Chair, I move that we accept RFA 162-15, the MCH Healthy Start Home Visitor part-time position, and accept the grant funds as recommended by staff.
Is there a second? I will second that. And call for clerk, Mr. Clerk, if you could do a roll call on this, I'd appreciate it.
Okay. Commissioner Shadwick,
Aye.
Commissioner Guile,
Nay.
getting this right down there. Sorry, Commissioner Price,
Nay.
Commissioner Larson,
Aye.
and Commissioner Smith.
Yes.
Passes 3-2.
Passes 3-2. Thank you for coming today. Appreciate it. Item number 3.
Community Corrections Monthly Update with Annie Grievous, Director.
Good morning.
Good morning.
This is for the month of May. 400, average daily population 495, 29 cases assigned, 23 closed, 552 served. 55 are in our juvenile intensive supervision program, 42 in our case management program, 18 are in our juvenile community intervention program, and 13 in our diversion program called Reset. Advisory board meeting, there was no meeting in the month of May, and due to the lack of agenda items, there was not one scheduled for June. The next advisory board meeting is July 23rd. Due to scheduling conflicts, the advisory subcommittee did not meet in May, but we did meet June 16th. Primary business was a review of the agency bylaws, an agreement to change 2 areas, and they'll be back in front of you after the board has reviewed those in July. One is being that a member can miss only 3 consecutive meetings. It said 3 consecutive meetings over a 6-month period. Our meetings fluctuate, as you can see, depending on agenda items and those kind of things. So we decided to just make it 3 consecutive meetings. The other area was brought to your attention last time I was here, in an error that was made by our office, in that there were only 3 commissioners listed on the bylaw and the agenda information. Of course, I'm not stupid. I know there's 5 of you now. But when we started the bylaw change, there were only 3 of you. And so I did not go back and make a correction. I'll try to do better on that from now on. That change will occur. The board will review it in July. And if the board approves to send all 5 of you agenda items and minutes, then you'll all 5 get them, as you've been getting them all along. I updated them on a request for field shirts for all staff to go out in the field day and night. We've had opposing thoughts about identifying ourselves. My staff go out from 7:30 in the morning until 1 or 2 o'clock in the morning, all the time. We do not identify our cars because that sets our cars up for vandalisms, gunshots be placed on them at any time. That just isn't smart. But staff do feel safer when they have some sort of identification on them. They wear a badge around their neck. They do have a radio direct to the police department, but they would like to have a field shirt that identifies them, a little badge on it, community corrections officer, because you go and knock on the door and you don't know who's answering that door. And if they see you as an officer, they may respond differently than if they think you're just somebody out on the street looking for them. So I contacted the Department of Corrections. We can buy out of our reimbursement budget field shirts for staff who want them. And so I updated the subcommittee and let them know that I don't know that everybody wants to wear them. I don't know yet what the deal is. I first wanted approval to spend budget dollars for those field shirts. I do have permission from the Department of Corrections to do so. The subcommittee has asked me to find out how many they want to spend and kind of have a price of what that would be. So I will be bringing that to the subcommittee prior to it going to the board. So I still have a little ways. I just wanted you to update where I'm at with that. Also, a review of the FY15 revocations to prison was done. I outlined the concern that DOC wants all offenders to go to do a prison dip prior to a full revocation. They have put out a survey, and I'm going to discuss that a little bit about that. And then we did our monthly client confidential information. The next subcommittee is July 21st. So with the legislative actions, you've brought attention to it already. It appears there are still significant cuts coming in the funding for FY16, which begins July 1st. At this point, we have no funding allocations. There are 3 grants out there, huge grants, that you have approved, the board has approved, and they're sitting there waiting to be funded. And because of what the legislators have done so far and where the funding cuts still remain, it's June 23rd, and our new year starts July 1st, and I don't know what I'm going to be able to do. So at this point, we just keep hanging on. There could be layoffs. I have no idea. And as soon as I get my funding allocation and I put it together in a budget and I know what I'll need to do to fund staffing and agency services, I'll let you know. I mentioned earlier the survey that DOC is putting out, and this could be partially related to funding. DOC funds you based on the number of successful completions and the number of people you revoke and take up a prison bed. They don't want you taking up prison beds. Unfortunately, community corrections can only do so much. A judge makes a recommendation to send to prison, and the county attorneys make recommendations. We do not have to play a role in that. So they put out a survey, and they listed all our FY15 revocations, and they wanted us to list what they were sent there for, what the judge recommended, what the county attorney recommended, what the officer recommended, well beyond most of our control. We don't recall what the judge recommended. We know they went to prison. We know that for sure. But anyway, I just wanted to update you just a little bit. They gave us a list of 71 offenders. Already, we found that 12 of them were sent on new convictions, not sent on revocation. So we already showed DOC there's an error in their data collection and got those 12 taken off. So it's 71 minus 12. Mr. Shadwick, I don't know what that is, but you're a money man. You can tell me what that is. 43 of those clients, we recommended a sanction and put them back on probation. We did not send them to prison. The judge or the county attorney went against us of those 43 times. The judge, we recommended of those 43 that they not go to prison. The judge or the county attorney went against us, and they went. We do not get to make that decision. 28 of those clients received direct revocation recommendations from our agency. So there were 28 clients that we did recommend a revocation to a prison bed. We own that. 11 of those were recommended prison dips, and the judge or the county attorney did not follow that recommendation. This doesn't mean a whole lot to you guys, and I get that, but I want you to be aware, first of all, that this is data that's being collected at the state level. Our agency is held to a higher standard than most agencies. We are expected to keep people out of prison, out of prison, out of prison. And if we don't keep them out of prison, our funding can be reduced. We did not meet their expectation in that they wanted us to recommend a prison dip on every client. In my opinion, prison dips aren't appropriate for every client. But if you go back and you look, 11 plus 43, that's 54 clients that we recommended not go to prison. So 54 clients we didn't think needed to go to prison, but they went to prison anyway beyond our control. So even though the judge or the county attorney got them to go to prison or recommended that, we will face the price of the ding on our funding based on that if that's where they so choose to make the funding cuts. So I want you to be aware of that message. And I know, am I turning red? Because I get a little upset when I talk about this.
Can I
Tell
ask
us.
real quick?
Yes.
Am I the only one that doesn't know? What's a prison dip?
A prison dip is a new law that was put out a few years ago where instead of recommending a revocation, you can recommend a 120-day prison dip or a 180-day prison dip. The client must serve at least 3 days in jail prior to that, so that would be the first sanction. Then if you took them to court and you didn't want them to be revoked, but you did want them to go get a taste of prison, see what it's like, and then bring them right back out on probation, that's what you would recommend. I think prison dips are very effective, and I think they work for a large population of people. Some people do not like them. It doesn't matter who, but some people don't like them because they only have to serve half their time. They get a day of good time for every day that they're there. So you send them for 120 days, and they have no problems. They're out in 60 days. So some people think it's a little bit of a skewed picture of it. I believe that everybody can serve a prison dip unless they've gone to prison and had extensive time in prison already. Going and putting yourself in there for 60 days and sitting in a cell and being fed 3 meals a day when you've gone and already been in there for 10 years or 5 years means nothing to them.
Okay.
So I don't find that effective, and we don't recommend those for that population. I may start recommending those for that population, but at this point, I don't support that. Then Rosie and I on May 13th traveled to Topeka, directors meeting, no significant updates. Of course, you wanted to hear about budgets, but they knew nothing. Then in juvenile services, we received our proposed grant application for FY16. The only changes, and this is significant, the only changes or corrections that needed to be made was in the prevention program caps. Our budget and our narrative was head on, spot on, had no changes or recommendations. So I'm proud of the staff. I'm proud of what we do in our agency because that application can sometimes get brutally critiqued, and they had no changes at all. And now, again, we're waiting for the governor to make the final determinations of reductions for we know what we're going to be funded in the juvenile program. And miscellaneous, quickly, next drug court graduation is August 10th. We have 5 graduates so far that will graduate on that date. I also want to thank those who attended the last drug court meeting. It was our largest graduation class, and I just thought it was a great event, and I appreciate everybody being there. That is it.
I just have one question. If the public is concerned about what the judge and the county attorney have done, how can they voice that concern?
That's a sticky question,
Yeah, I mean-
Mr.
One thing
Shepherd.
is voting.
Yeah, voting, I guess.
Well, our judges aren't voted.
No,
They're
but
appointed. You know
some-
what? I think letting them know, just letting them know that, here's what I would say to you is if I was a judge, I would probably tell you, I can't be worried about community corrections funding because of the people I send to prison. Because you know what? I obviously feel they need to go to prison. I'm going to go against their recommendation. I think the county would argue the
All 43
same
out of
thing.
43, that just sounds like there's more than looking at this person and this person and this person. It's just basic. It sounds to me like a blanket.
And that's 43 over a 12-month period, so I want to make sure you're clear about that.
that's true.
So that does spread them out. And also, I would have to almost show you every little thing about that. And that's why the survey was difficult for us to fill out, because they wanted us to recall why the judge went against our recommendation. I can't recall those all. We went to staff, we tried to pull them in the files. If you didn't document that the judge said these statements, it's hard to say. I can tell you that I attend regular judges' meetings and the county attorney, and they understand how we're funded, and they understand that we're going to take every effort prior to revocation. They understand that. And also, I want to say this, our judges and our county attorneys do work well with us, and they do give us lots of opportunities to work well with the client population. Judge Johnson through drug court's a prime example.
Mm-hmm.
We do get a lot of that. It just is disheartening on our end when we know that we're funded based off of that.
And plus, if you're being funded and you're being more or less paid to do that job, and nobody's paying any attention to you, why have the job? No, I mean,
Well,
it's pretty
people are paying attention. We're getting a lot of cases. They know that we do good work, and I know that, and I know that they know we go out and seek every resource we can. I think that there is just a point where community corrections is still willing to work with a client, and a judge says, you know what, you've done enough, or what,
And I
And I
think-
get that. They both have other jobs to do. The judge and the county attorney have opposite jobs to do, and they're not always going to agree with us, and I understand that.
And I think as county commissioners, we look at home health, and we've gone with it. We look at Heartland, we go with it. We may look at something, we don't go with it. I mean, you're not 100%. We have to think about it and make decisions. And I think we have good decisions, and yet sometimes judges kind of get hit like commissioners, but they can revote on commissioners if they don't like it, but, and county attorneys can be voted
I
on.
do think we
so,
have some of the best judges in the state, and I do think our county attorney's office is awesome. I just say that, unfortunately, we have a job to do and they have a job to do. I wish our funding wasn't tied to something that we have little control over.
And I wouldn't have been aware of that until you let me
Yeah.
know, so
Yeah.
thank you.
Thanks for that, yeah.
Thank you.
Anything else?
Can't
Thank
be
you.
everything for everybody.
Thank you, Annie.
Thank you very much.
Move on to item number 4.
Livestock and Expo monthly update with Phil Penn, Director.
There's no public comment. We're not taking public comment after commission updates. We have been doing it for a while. Item number 4.
Good morning, Commissioners. You have my update. If there's any questions on that, well, I'll sure be glad to answer. Got a few photos here from events that we had here in the last month. This first one was actually a new event. It was a small animal swap and swap meet and auction, and as you can see, it was well attended. Unfortunately, with the avian influenza with the poultry, that may get dinged a little bit here. He's hoping to have another one next month, so we'll kind of see how that works out without the poultry, but will hopefully still be a success for Terry Long. I'll kind of
What do they do exactly with that? What's going on there?
on
The
this
poultry?
right
Uh-huh.
here. It was just small animals, poultry, rabbits, and they actually had people either swapping those animals with each other or an auction. They did have an auction with that, so I think he said he went through over 200 animals.
Wow.
So I know he didn't have enough cages.
Huh.
So,
chicken for a rabbit.
Yeah.
yeah, so there was a lot of people at that time
Rabbits taste good.
looking for chickens or turkeys or rabbits or something. So, yeah, he was real happy. Terry Long was the one with the fire department who was actually involved in this, and it went over very, very well for him.
When I was a kid, my mother said I wouldn't take you to a chicken fight. They used to have chicken meetings at Headville. Do you know that? Yeah.
Is that where they have the dogs
Prospect.
up there? The dog run? Is that
Yeah.
where that was at?
Yeah,
So it's
and we
caged.
actually, we put up, anytime we have something that's going on over there, we give at least 2 or 3 days notice to those folks who want to walk their dogs that it's going to be closed to them. And so we didn't have a bunch of dogs running through there that day. And
Is this poultry disease going to affect our chickens at the fair?
yeah, there won't be any
There won't,
poultry.
well,
at
that's
the
too
fair.
bad, isn't it?
Yeah.
And what about rabbits? Do rabbits have that problem?
No, they'll be fine. Yeah, it's just in the poultry industry. So there won't be
Well, that's a shame.
chickens, ducks, turkeys,
That'll-
all those kind of things.
That's a shame.
Yeah,
That'll
all the
hurt
way
the-
through December.
The fair was, really has a big chicken.
They do.
They
have-
did.
Yeah,
Yeah, it was really big.
yeah. So it'll affect not only our fair, but state fair,
All of them.
all of them.
Mhm.
Yeah,
We-
so.
We probably won't have a 4-H chicken queen this year then.
Well, yeah, I don't know if they had a chicken.
They had rabbit
That's
queens.
interesting.
They've had rabbit queens.
When we were in New Orleans, they were all rabbit queens, weren't they?
Yeah, you may have started a trend right there, Commissioner Price, chicken queen.
John wants to judge it.
Yeah. This was the concert we had in the 4-H building. This was just how we got it set up, and then they came in and put in all their sound equipment and stuff. I'll try to kind of go through these real fast. I got quite a few of them here, but there's the night of the concert.
Oh, my
and
goodness.
had close to 400 people there. So
Commissioner Price came.
well, I don't know.
That's
if
me
that
with the
was-
guitar. That's me with the
You know, I
guitar.
don't know if that was probably anybody in this room's kind of music, but they are talented. They're a very good band. If that's kind of music you kind of like to listen to, but
Could
they
you
were
sing us a
very
verse real quick?
talented.
Could you kind of do a verse, how it sounds like?
I couldn't recite one of those. Yeah. So several of these, sorry, they were so dark, but
Did the ceiling tile stay up?
yeah, I did actually. Yeah.
Remember when the all of ceiling tile came
That,
down?
yeah, that was with a monster
Beach Boys,
truck,
wasn't it?
monster truck deal
Yeah, I
or
remember
something
that. I
over
was
there.
there
Oh, yeah, but the Beach Boys, boy, that thing,
Yeah.
the tile and the lights came down and everything.
Kind of go through several of these. But yeah, it was well attended and everything went well, and security did a great job and didn't have any problems at all. Of course, this Canine Capers, again, they were in Ag Hall and Kenwood. This was what it looked like when the miniature horses moved in.
Wow,
Wow.
Pretty good
They
fleet of
came
trucks.
from
there's some money there.
eight different states for this show. So they'll be back again next year. So yeah, it was, and you can imagine that this was going on the same time as the River Festival.
River Festival.
Man,
It
So
was plugged up over there.
we got glaring looks, and if you could read lips, we were able to read a few lips about people not being able to park over there. But it was everybody. It all worked out and worked out very well with everybody, and so we were thankful for that. We had a hazmat training thing with the Saline Fire Department, and this is just outfit out of Fort Riley, and they spent the day there. They were actually there on Wednesday of the River Festival. So not only did the next day the horses took up all the parking, but
They had the whole east
they had the
side.
whole parking lot that day before. So, but they didn't get many arguments, I don't
No.
think. So
Hosed them down.
uh,
That was quite a lot.
it was a good turnout for
And it wasn't
For the-
raining.
and it wasn't raining.
goodness
Exactly.
for that.
Yes, that was almost a miracle. There's another horse show picture. There's a couple of them happy to be there, I guess.
Little they are.
Yeah. Yeah, they're probably, most of those, the miniatures, probably head high, they would come up to my waist.
Oh my
So, yeah.
Cute little birds.
They're little guys, and to see them pull those carts around and with people on them is quite a deal.
and how far away did some of those come?
It was an area, what they call their Area 6 show, so I think it was about 8 states.
Wow,
Yeah.
pretty good distance.
This is the tattoo
I missed that.
event we had. And they put the Steel Expo because they were doing piercings. So
Ouch.
this is just it was a good turnout, and people getting tattooed there, and it was well attended. They'll be back next year also.
Oh,
So, and that's our schedule. It doesn't lighten up next month either, so which is good.
Look at that.
Um,
And that's just,
We'll be, towards the end of next month, of course, we'll be kind of getting ready for our fair. Last probably week and a half of that, so got a couple more things in between then, though.
Keeping busy.
Yes, yes.
All right, well, thank you for
Yeah.
coming by.
Sure.
Appreciate
Thank you,
it.
Commissioners, appreciate it.
Thanks, Bill.
well
Item
done.
number 5.
This is approval of county commission minutes for June 16th.
So moved.
I'll second that.
Yeah, I'll do that. Yeah. I'll do that. Is there a motion and a second? Is there any public comment or corrections needed?
Ray Ruska, 235 North Santa Fe. Today I was talking with Don Merriman on his diligent work on getting these minutes done, and it's a really hard job for him to do that. And he's really been doing a good job, and I just wanted to commend him for that.
Appreciate you saying that.
Okay.
Thank you.
Thank you. Is there a motion and a second? All those in favor say aye.
Aye.
Passes
Aye.
5-0. Is there any other business or announcement that need to come forward today? Motion to adjourn?
Mr. Chair, I move that we adjourn.
Second.
All those in favor say aye.
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 We are adjourned. Go do hay.